So I'm sitting here in the parking lot of my therapy place, and I just got done with the session. And usually after my sessions are super hard, so I usually don't like, really doing much or whatever. But one thing I have found that I can't go home, even as tired as it makes you, because it completely just drains you, like with your mind and body and everything, that I can't go home and lay in bed and just sleep it off or watch a movie or take it easy or whatever. So I've been kind of frustrated lately, okay? Because with my EMDR therapy, I feel like it's like I've been disabled. Like I was doing so well with my business. I was super successful. July, I got a promotion and a bonus. And then I started doing narrative therapy, which is different. And then I felt okay, but I still felt like I was hitting a brick wall. Like I wasn't getting where I needed or wanted to be. And it was super, super frustrating. And then that counselor that I did the narrative therapy with and the marriage counseling that we're doing with, she's like, it's time for you to do EMDR. Eye movement, desensitization, reprocessing. I think I did it all. Anyways, so I was like, I don't want to do this. It's going to be super, super hard. Well, little did I know it was going to be very, very hard and terrifying and excruciating and bring back anxiety and some of my depression. I'm sitting here going like, why in the world is this supposed to happen? Well, haven't we always heard of the saying that it usually gets worse before it gets better? Or when one door closes, another one opens. And so I'm going by that belief and knowing that I'm in good hands and that I'll be taken care of and things will get better. So it's been super, super tough because it's thrown me through a loop. I've been very impatient with myself and frustrated because I'm not where I want to be, right where I want to be. And it takes a lot of patience, not only from me, but from my family, from my kids, from my husband, from my friends, from my coworkers, that I'm working with, in not being my best self. And there are days where I can't even function because it brings me back to a place in my life where I'm completely upset and feel broken. So here's the thing of EMDR, okay? So for a lot of people aren't familiar with what that is. And it's, not the days of the week or anything like that. What it is it helps your brain to reprocess trauma. And it's for traumatic things. So because mine started when I was a little kid, when you're a little kid, your brain processes things so much as a little kid. And it makes it hard because if you had the trauma happen when you were an adult, it would be much easier to clean up and clear out. But now that it happened when I was a little kid, where you learn what your worth is as a little kid, you learn what, you're supposed to be and how you are, and you learn emotions and feelings and all these different things when you're a kid. Well, if you've been sexually abused, what does that do to your worth and learning what you're supposed to be and who you are and all those type of things? It completely screws things up for you. So now what we're having to do, and I learned this today and it put me a lot more at peace, because over the weekend, because my EMDR is usually done on Mondays because of the holiday, it was done today. I am a mad wreck. Like, my anxiety is bad. I flip out at the family. I'm super ornery. I can't enjoy anything, no matter what it is that we're doing. And I really struggle with things. And so when he explained to me today, it put me at a lot of peace. I had my husband come with me today. This was his first time coming and seeing my doctor and meeting him and seeing and watching what EMDR is, because it's like you holding these little key fobs in your hand, shoulders length apart, and you watch this light that blinks back and forth from side to side. And with your eyes going back and forth, your eyes follow it, your brain starts to process. When your eyes go back and forth on things, your brain starts to do all the work. It's really crazy and amazing. And your brain starts to think of all these things all over your whole entire life. And so I guess if you've never had attention deficit disorder, you would know what it feels like when you're doing EMDR, because I was telling him, I says, I'm doing it all wrong. My brain's all over the place. He's like, no, that's exactly what you're supposed to feel like. I'm like, geez, this is what it feels like when you're not on medication. You can't function or focus on just one thing. Your brain's all over the place. And so he's like, yeah, that's totally okay. So it's taking my brain from feeling super uncomfortable with things to, by the end of the session, to thinking like an adult. So instead of my brain thinking like a child would, because we all have that inner child in us, where when we get angry, when we get upset, it's that little kid part of us that's not thinking rational. It's not thinking about how we should act the right way. It's training my brain to think as an adult. So instead of my brain, every time something happens to me, like maybe a friend says something to me, instead of taking it offensively and having that little kid brain turn on of thinking, oh, that person's going to abandon me, they're going to hurt me, they're saying not nice things, it's starting to train my brain as thinking as an adult, like, oh, I wonder what they're thinking and feeling by that. And instead of responding and reacting to it in a negative way, I would more likely be, okay, well, what did you mean by this, Like, is this what you meant? Is this what you're thinking and feeling? So with my husband coming today, he had to miss some work, but I really needed him there, because it's getting to a place where it's getting hard. It's getting hard for him to continue being patient. Like, this is my sixth session, and I do one a week, and he was getting to the point where it's like, I don't understand why we're still in this place. And for us as humans, our biggest tendency is to become impatient. We want things. We're the type of people that want quick fixes. We want things to happen right away. We want to be our best selves and look our best selves and everything right away. We've got to have things instantly. And so that's super hard when you're not given something instantly. And so when I had him come to my therapy appointment today, he was like, it was so neat to see him and my doctor connect. This was his first time meeting him. And he's now going to possibly go and get EMDR for his trauma that he had as a kid. But he's going to have an outlet, because my doctor's a man, my husband's a man, and so they'll be able to talk back and forth, and my husband will feel like he has a support system and be able to feel like, I can talk about the frustrations I'm feeling and not take it out on my wife. I can talk about how I'm feeling impatient and frustrated because Lisa's therapy isn't going as quick as I want it to go, and her improvements and stuff, but I have somebody that can give me the tools and things to cope and function, and how to be the strong husband I need to be while she's going through this. And it was like all that anxiety and fear and being pissed off over the weekend. It's like I'm sitting here in my car, and it's like I can actually breathe, because I have that support system again. I have that, my husband, who has just been filled back up. You know, he was running on low with gasoline, and now he's got the amount that he needs again. And so his appointment's not for a couple weeks, but it's gonna be amazing. The transformation, guys, that has happened in just 8 months with our marriage, with us individually, with the therapy that we both have been given and stuff. Most people wouldn't talk about it here on Lives. It would be embarrassing. At first, it was embarrassing for my husband to even have me talk about it. But the reason why I come on all the time, and I've started my own YouTube channel, is because so many, I would say 95% of Americans struggle with something in their lives. And they're either too afraid or worried that they can't afford it, or that they're just used to feeling a certain way and they feel like they just have to sit in that position the rest of their lives. Or they've tried a million different things with a million different people and they haven't found the right match. And sometimes it's just like a restaurant. Sometimes we have to try like 60 different restaurants before we find our most favorite one. And then when we do, we continue going back to that same restaurant and ordering different things or trying the same things, because we've learned to love it and we've become comfortable with it. So with my complex PTSD that I have, complex means that it has started in early childhood all the way up to as an adult. I am left feeling after each session, and I wish I could hold on to that feeling, and I can usually until the weekend, that I can do this and I can't wait for the new me to come out. And I talked to my doctor today and I was like, you know what? I don't want my business to suffer. I don't want my marriage to suffer. I want to be present with my children. I want them not to feel like I'm hiding out in my room because I can't deal with, the fear of people losing their patience with me, of not, being a quick fix and things like that. And he says, you just have to be patient with the system. I hate that word patience. I really, really do. I hate the word patience. But everything in life stems from patience. Anything worth anything comes from patience. And it was neat for him to be able to help us to relate to him and showing us that he's not this man on a pedestal that knows everything and knows all, that we were able to feel like we were all on the same level as he was talking to us. So then he got out the paddles, the little things that I hold with the lights, and it vibrates and stuff so that your focus stays on those paddles. My husband sat there and watched, and he explained to my husband all the steps and everything. And I really suggest, if you're going through individual counseling or you're going through EMDR, take your spouse with you at least once so that they can kind of be a part of the experience with you, and so that they can kind of understand, like, when you go in, this is what it looks like, this is what it feels like, this is what the doctor says, this is how the doctor is. Because I really feel strongly now that we've done that with my husband and this doctor, this specialist, that he will be able to be more on board with me. Because in order to go through these things, you have to have support. You have to have support from friends and family and a spouse. Because when you're down in the dumps, you've got to be able to have somebody help you pull you through it. I'm really, really grateful that I do have a spouse that is there for me to help me through it, because, man, for the ones of you that have done it by yourself, like, kudos to you, because it's super, super tough. But it always empowers me on the days that I have EMDR, where I feel like I'm Superwoman and I can go out and help anyone and everyone. But I've also got to remind myself that on the weekends, when I automatically know it's going to be super, super hard, because I'm preparing myself for something my brain's telling me is going to be so scary for Monday, the EMDR, I've got to tell myself and walk myself through it with the tools that he's given me, that EMDR isn't scary. Like, going and being in his office, he's not torturing me. He's not hurting me. He's a good person, and he's helping me relieve pain that I have been holding on to for years and years and years. Sorry, guys, that just kind of hit me. And to be able to know that eventually this big house that my brain has, this big mansion that my brain is, eventually will be all completely cleaned out, that I can't expect it just to happen in 6 weeks, that I've got to realize that 32 years worth of constant trauma will be amazing if I get it done in a couple years, versus 32 years of having to live it. And then having to realize, when some of these areas of our body are cleaned out from trauma, our brains and our bodies start to go through this transition of, what do I do now? What am I supposed to experience and think and feel now? This is uncomfortable. And so typically what happens is our brain and our body start to hold on to or pull uncomfortable things back in to try and make up for those empty places that we cleaned out from trauma. Doesn't mean that our brains are going to suck back all the stuff that we just got out. It has nothing to do with that. It just means that, like, for me, because at that time I was supposed to learn what worth was, what it felt like, what love feels like, what love looks like, what the right way to love is, the right way to experience love, how it's supposed to come, where it's supposed to come from. Because I didn't learn any of that, my brain is starting to have to learn, okay, negative goes out, and this is how I feel and experience positive. This is what it looks like. This is what it's going to be like in my life. It looks like this. It feels like this. This is how I'm going to continue bringing it back in. When my husband says this, it doesn't mean that. If I don't understand that, then I ask that rather than having expectations. I have agreements with him. Okay, Jake, when I'm starting to be in panic mode like this is usually what I'm feeling. When I'm feeling and reacting and responding like this, can you respond back to me like this? Can you say to me when I'm saying, I'm just so frustrated with you, you make me so mad, and it happens on a weekend, then he says to me, well, what are you feeling? Where's this feeling coming from? What is going through your mind? Then he also explained to us today the differences between men and women. And I've heard it over and over again, how people will sit there and say, well, there's differences between men and women. I know. But I never got the actual visual. And with me having ADD, I need that visual. So what he explained to my husband and I, where we're like, okay, is with men, they have these drawers. And when they're in one drawer, like the work drawer, and you're trying to talk to them about something else, their brain can only focus on one drawer at a time. Whereas with women, we can be on the phone, we can be telling our kids to get along, we could be driving at the same time, or we could be holding a baby on the phone and cooking dinner. So we can have a whole bunch of drawers open at the same time and be doing a whole bunch of things. And so with men, what he explained for us to do is to be understanding of like, okay, when my husband comes home, he's probably most likely still going to have that drawer open of work. And so I can go up to him and say, hey, how long do you need until you can close that drawer of work? What do you need to work on before we can open the Lisa drawer or the kid drawer or the dinner drawer? And we kind of laughed. We're like, is that what we should say to each other? And he's like, if you're a visual person, do it, because that will help remind you over and over again, this is how different you two are, and how this will help him switch over to what he needs to switch over and be done with that one drawer. So then with women, what he said for men to do with women is not to try and fix things. Women do not like it when a man tries to fix what they're thinking and feeling and doing. And so my husband's like, starts laughing. He says, well, what in the world am I supposed to do then? And he says, well, when she is upset about something, just say, so what are you going to do about it? Like, how did that make you feel? Like, what are you thinking on it? And look at her in the face, look her in the eye, and she's going to look at you like, oh, and she'll continue talking, and you won't even have to do anything but sit there and listen. Don't try to fix what she's saying. Do not say, well, you should do this, or why don't you do that? He's like, the only time you do that is if she asks you, what should I do about this? And then you can give your 2 cents. Well, I was thinking about this, or how about that? And so those were the two differences. So I just kind of wanted to come on and share it with you, because I figured, in many shapes and forms, with the way that people respond and react with how much traumatic things that happen in different people's lives and stuff, we need to be able to have tools to get through them. Because as I did as a teenager, alcohol and drugs, it really didn't even numb things. It only gave you an addiction. And so people who get on those things, because I've been there, are ones that are trying to numb something that hurt them long ago or previously. And the way to get through that is to, even if you have to go through 100 different counselors, I highly suggest it's not a bad idea. And that's coming from the mouth of somebody that before could have told you it's a stupid idea, they don't help you, they're just in it for money, they're not going to be able to figure you out, they'll just move you from one counselor to the other, they'll just put you on medication, they'll put you in a hospital, whatever it is. But now I can honestly say that from being in it for 8 months and then 6 weeks of the EMDR part of it and 8 months of marriage counseling and 8 months of individual counseling, I can honestly say, and it shows the fact that I'm still doing this, that it makes a difference. Otherwise I wouldn't continue. Because yeah, it does cost money, and it does take time, and it does take sacrifice. But the biggest thing that it does take is for you to be strong enough to admit that you need help. And that doesn't make you a weak person, that makes you a strong person. So if you're looking into something that, you know somebody could use the help or whatever, or you're in fear that they won't listen to you, show them some of my videos. Log on YouTube under Lisa N, the letter N, Jake Cute, and show your family members some of these videos, because it takes just a few of us to be brave enough to post about this in order for tons and tons of people to get help. So I believe in you, I believe in myself, and I know I can get where I want to be and where I need to be, but it's gonna take some time, so I have to have patience with myself. But good luck with yourself, for those you know, and your family and friends, that there is hope and things can get better. So hang in there.